to also, I really want to acknowledge the PI team, so Policy Innovation Engagement team, so Langston Burdine and the members of his team who are here today, who put in a tremendous amount of work to assure that the plan that we're moving forward over the course of the next 5 years really reflects the data that we have in the city of Milwaukee, is really addressing the health disparities that we experience in our city, and also really recognizing the structural racism that is also experienced in the city of Milwaukee that's driving some of these disparities. So thank you to my team for really their diligent and hard work on this plan. And with that, I just want to reiterate how important it is to us to get feedback from everyone here today and moving forward. This plan is about the work that we are all doing collectively to address health in the city of Milwaukee, and we can't do it without you. So thank you for being here, and thank you for your continued engagement. And so with that, I will turn it over to either Erica Sinclair or Wuji Zhang to give some opening comments.
So I guess I'll go. This is Erica Sinclair, board member for the City of Milwaukee Health Department, and I would say proud board member, actually. I so appreciate everyone's time and energy, again, that was put into this report, and put into this time as to create, you said, the next 5 years to be what it needs to be, which is one of health equity and healthcare access being at the forefront and the priority of everyone in this city and outside of this city. And being born and raised in Milwaukee, being on the board, having worked for the City of Milwaukee Health Department in the past, this is personal. And everything I do is personal. I mean, I'm in that space where my professional and my personal all come together, which is why I do the work that I do in the community the way I do it. And I appreciate the approach that you all are having to having the sessions and asking people what they want to hear and think about and process. And that is in being in a space where that you all are actually doing these listening sessions, that you're actually listening, and to also be in a space to hold you accountable to make sure you're listening. It makes me feel very special and honored to be able to be a representative of both the community as of Milwaukee, but also the professional community as a public health professional, and as a business owner, a mother, and someone that just loves to serve the community. So I appreciate you all being here. It is very, very, very important, and especially towards, like you said, erasing. I'm going to just be bold enough to say erasing the racism and especially the structural racism that has been created in Milwaukee. It is possible, and we all have a role to play in it, and I'm ready for us to get to work, roll up our sleeves and get to work. It's going to take all of us to do it, and I believe that we actually can do it. That's the audacity that I hold. Wuji?
Hello, everyone. Thank you for being here this evening. My name is Wujie Zhang. I am a professor at the Milwaukee School of Engineering with background in biomedical engineering and food science, specializing in drug delivery, regenerative medicine, and cancer treatment. I am excited and honored to be here this evening. Public engagement is critical to the success and well-being of our city and informs our work as members of the Board of Health. We are responsible for advising the health department on matters of policy and priorities that impact people and communities. We are in this together, you, me, our friends, and our neighbors, to elevate the quality of life for all. Thank you.
Thank you all for those kind remarks. We really appreciate it. So let's get to it. If we can go to the next slide. So a couple housekeeping things before we get started. So what we're asking of everyone is to please stay muted when you're not talking or when others are talking. Cameras are completely optional, definitely encouraged when we move to our small group discussions. You can put your questions in the chat as well and save those for your small group discussions as questions come up. Feel free to write those down so we can use them during the small group discussions. Just note that anyone using discriminatory or inappropriate language will be removed from the meeting. And the last thing that I'll add is when we get to our small group space, please take space, meaning we want to hear your voice. But also sometimes it's important to take a step back so that others can step forward and share their comments as well. So it's kind of one of those, we got to monitor ourselves. So if you're hearing yourself a lot, it means everybody else is as well. So make sure you allow others to take space during those discussions. Next, we just want to acknowledge MHD's commitment to anti-racism. Anti-racism is really central to our strategic planning process. If you haven't seen our strategic plan as of yet, I really encourage you to check out the plan. It is on our website, and if I can have one of my colleagues put that in the chat. It centers around 4 main pillars of work for our health department around our culture and redeveloping our culture as a department, managing our operations efficiently and effectively, making sure we take care of our staff, our people, and building forward towards Public Health 3.0, which is a model of public health that centers the health department as a key contributor and facilitator of connections within the community. But also it requires us as a health department to acknowledge our roles in racial equity and racism as a public health crisis, and acknowledging our roles in fighting that fight, frankly, across our different strategies. And so as you get a chance to check out the plan, you'll see how we've integrated that throughout our strategic plan, which will, again, guide our work for the next 5 years. Next slide, please. So the purpose of today's meetings. So this meeting is really to help us inform 3 to 5 priorities, which will be included in the next community health improvement plan based on the available data. And we'll talk about that data in just a moment. Our agenda for today, we'll start off with an overview of the CHIP, where we are currently, as well as next steps. We'll share some information from our community health assessment, or our CHAW. We'll review with you all some community input results, and how the community has been involved up to this point in helping us align our strategies. We'll review a few additional data sources that have been incorporated into this work so far. Then we'll move into our small group discussions and 2 different activities to make sure we can catch everyone's voices and opinions and feedbacks throughout this evening. And then we'll do a large group debrief, and our plan will be to adjourn and wrap up by 7:30. So this is where we are right now. So the community health improvement process is a 8-step process, right? We start off with step 1, which is identifying community partners. Step 2, acquire and analyze appropriate data and data sources. 3 and 4 is where we're at right now. Step 3, present community health needs assessment. If you haven't checked that out yet, our community health assessment just went live last week or so. Step 4, prioritize community health issues. And so that's what we're going to be talking about quite a bit today. After today, we then move into the next phase of this process. Step 5 is recruiting additional community members that will then participate on action teams that will work towards, issues that this team helps, this meeting and the folks who are part of this meeting will help us identify and prioritize. Step 6, those community partners, MHD and others will then plan on strategies for interventions, whatever those interventions might be, and how do we implement those interventions. Next, we'll finalize and present the community health improvement plan to the community, get your feedback, and then we'll start implementing the plan. So our action teams and our strategic planning teams will now start to do the work. And this isn't, the neat thing about the community health improvement plan is that this isn't just a Milwaukee Health Department project. The community health improvement planning process is really about community engagement and community alignment over time, right? So this plan is a 5-year plan. And so we're committed to working with the community to address the needs and the issues that the community has identified and that they want the health department to prioritize. Really quick overview. So in 2017, we launched our last iteration of the Community Health Improvement Plan, focused on safe and healthy neighborhoods. As a part of this process, or as a part of the design of this plan, I should say, we went through a very similar process that we're going through right now. The 3 priority areas that came out of this planning process were positive mental health, economic security, fair and inclusive society, eliminating racism. So here we are. So this is where the work that's been done thus far and over this summer. I won't go into great detail now because my team will share the details of each bullet point that you see on the screen right now. But over the summer, we did a significant amount of outreach to communities in Milwaukee. I would say we specifically focused on communities that historically have maybe not been included in these type of processes, and communities that have been historically disinvested in, right? And so we're making sure we are trying to put together a process that is equitable, that includes the voices that are representative of the city of Milwaukee. And you'll see a little more about that when we get to that point in the slide deck. We utilize a process for our community health improvement plan called MAP, which is mobilizing action through planning and partnerships. It is a tool that is managed by, I believe it's the CDC and NACCHO. As a part of MAP 1.0, we've already completed a Forces of Change project, as well as a local public health system assessment, which we'll talk about in a bit. We were also a member of a MAP 2.0 pilot. We were one of 6 sites chosen around the country to pilot certain components of the new MAP process that will come out. So we're really excited to do that. And then we'll be moving towards identifying our priority areas. And like I said, that will, this meeting today will help us determine what those priorities will be. So we have a poll that we'll share with you all. So what are what are the top 3 community health issues based on your knowledge and experience? And so you should see a priority poll number 1 pop up on your screen. We would like you to select just 3 community health issues that, based on your experience, should be those top priorities. We have maybe 20 more seconds. So 77% of folks have participated so far. All right, 5 more seconds. All right. All right, so from the results, you can see on the screen, 80% of folks selected racism and health equity as a key priority or part of their top 3 community health issues. Safety and violence prevention. Let me see. Yeah, well, I think mental health came next with 68%, and then safety and violence prevention at 54%. Followed by essentially the rest of the group between 5 and 20% of the attendees selected those. Thank you for sharing that with us. All right. And so next, what we're going to do is share a bit of data with you all, and I'll let my colleagues take over at this point. Essentially, how we would like you all to follow along with this is we'll utilize this graph here. Some of the data that that we'll be sharing today is MHD data that we've created, that we've collected, and then others are from external sources. And so we're going to go step by step through each one of these reports and share a little bit about what we've learned along the way.
All right, thank you, Langston. So we're going to start off with the community health assessment. And basically with the community health assessment, we took out from various sources. So it could be primary or secondary, internal and external data sources. And some of the most ones used is like the Health Compass Milwaukee, Big Cities Coalition, the County Health Ranking, and also the American Community Survey, plus with the US Census. So a quick overview of the CHA. Basically, it's a document and the foundation of improving and promoting the health of the city of the residents. Here at the health department, we try to investigate certain health status of the community, describing since the last CHA that was created. Usually the CHA is every 3 years, and we try to identify opportunities where we can improve the health of our community. It's a collection and analyzing certain large data ranges. So basically, like I said before, primary or secondary sources. This also can include like demographics, socioeconomic, and health statistics. The summary of available evidence will serve as a resource for the development of our City of Milwaukee Community Health Improvement Plan, also known as the CHIP. So quick demographics here from the City of Milwaukee. And like how our Director Langston said, the CHA just got officially published. So I believe they did post a link on the group chat, and as well, you could find it on our website. So a quick overview of race and ethnicity. So since the last CHA been created, we're really not seeing a change. Non-Hispanic and Latinos around 77%, where our Hispanic Latino population is about 20%. And for race, we have pretty even for our Black African American community, and our white Black African American communities around 38.6%, and our white is around 36.1%. And then looking at the age and life expectancy as a whole, the City of Milwaukee is actually a younger city compared to a lot of other cities across the states. 18 years and over is around 75%. And then our second is under 18 at around 24%. And then our life expectancy, I'll talk about it more in our upcoming slides, but our highest average age is Asian at 81.2 years, and the lowest at 70 years old is our Black and African American community. For economy here in Milwaukee, it's pretty stable. So private companies, usually around 73.2% for type of employment. And then our second is local, state, federal government at 11.2%. Our unemployment rates around 3.4%, and our median household incomes around $43,125. Home ownership here, we're seeing kind of a disparity amongst white and Black American folks. Our white population's around 56%, where our Black and African American communities are around 25%. Our education as a whole is pretty good compared to a lot of other cities across the states. High school graduations at 79.8%, and female student awarded college degrees is around 59%. So in the CHA, they're always talking about indicators. So what are indicators? Indicators are basically statistics used to measure current conditions, as well as to forecast like a healthy behavior. health status and public health system performance at the local level. So here in Milwaukee, part of the Wisconsin statute 250.30, I believe, it is required for us to generate the CHA. So our topic of areas that are really important here in the city of Milwaukee are listed here. And some of the popular ones here that we see are racism and health equity, safety and violence prevention, sexual and reproductive health, built environment, economic security, nutritional and physical activity, substance use, mental health, healthcare access, and infectious disease. So like our commissioner said, we are committed to the anti-racism approach. So our first topic of area and interest is how racism hurts our health. So racism structures opportunity and assigns value based on how a person looks. So it's like a superficial judgment. Basically, the result in this is that the conditions are unfairly advantaged and unfairly disadvantaged to others. Racism hurts the health of our nation by preventing some people the opportunity to access environments and resources that promote health. So the indicators that I'll talk about next are a result of racism, and you could see a huge racial disparity amongst our Black African American communities, Hispanics, Asians, versus whites and other ethnicity and races. So 2 examples of racism that happened here in Milwaukee is the redlining on the left. You could see the map where the red line areas are the ones that are disadvantaged, where they can't. This was created basically in 1930s, where those areas could not get a loan. They couldn't ask to get any financial support in bettering their neighborhoods, while the green areas were the most richest, best areas that could potentially would get a loan and everything like that. And then our life expectancy here in Milwaukee, as you could see, we have a huge disparity in Black at 70 years old, and then our highest at 81.2 years old, 0.2 years old for our Asian community. And that's a huge racial disparity. And there's a lot of factors that come into it. For instance, like access to healthcare, mental health, gun violence, all the other indicators that we'll be talking about. So our second one I wanted to talk about is our safety and violence prevention. Most gun violent victims in the city of Milwaukee are Black males. 89% are considered non-Hispanic, and 83% are considered Black or African American. And if you notice, since 2018 to 2021, there has been an alarming increase in gun violence. And you can even look at like the fatal versus non-fatal, and then total. Our third one is going to be our sexual reproductive health. Here, we're going to talk about Milwaukee has seen a 300% rise in syphilis cases during the COVID-19 pandemic. 82% of syphilis cases identified were males, and 63% of syphilis cases identified as African American or Black. And then if you notice here in 2015 to 2020, you can look at the case rate, and it's increased basically about, I would say, quadrupled, sorry. And our next one is infant mortality rate for Black babies is more than double the infant mortality rate for white babies. And you could see it on the stacked row chart that the most affected are the Black African American babies. Our built environment we're going to talk about is the child-led elevated blood levels. And the prevalence of elevated blood levels here has actually decreased 90% since 1997. But that's also good because our testing has also increased 66% during that same time period. So we are taking it serious with lead testing and helping out with housing that could be potential exposed to lead. Economic security here, Black children experience poverty at the highest rate, while Native and Indigenous folks experienced the highest overall poverty rate. And you could see also the racial disparity here, where our Black community are mostly affected by poverty. And our nutrition and physical activity, according to Feeding America, 111,910 individuals living in Milwaukee County experienced food insecurity in 2020. 21% we have are considered child food insecurity. Substance misuse, opioid-related deaths have increased since 2016, driven by increased use of fentanyl, which is involved in nearly 80% of the drug OD deaths. And as you could tell from 2016 to 2020, we are just increasing in OD deaths. So this is a serious problem here that we're facing in the city. In 2020, in Milwaukee County, there was a count of 424 deaths, opioid-related deaths. Mental health is a huge issue. And in the survey that was previously taken in the CHA, access to mental health service ranked actually number 2 for respondents. And as you could tell with even our survey that we just did, mental health is a concern here in the city of Milwaukee. Our healthcare access as a whole in the city of Milwaukee is pretty good. Adults with health insurance is about 89.2%, where adults who had a routine checkup is around 76.2%. Also, adults who visited a dentist is around 60.7%. And lastly, our infectious disease. Here we have 55.13% of City of Milwaukee residents have completed the primary vaccination series for COVID-19. And you could look at the vaccine trends over time by age group. And also we have it percentage population by race, ethnicity, and the percentage. Do we have any questions?
So I see one in the chat that was asking if you could speak more to the percentages. I think this was in reference to was it in the sexual and reproductive health? That's correct.
It was in general. I guess I was unclear about some of the percentages when we went through. Are they of I can't remember exactly which slide is anymore, but if it was of the population or if it was of that group within that group. So just
yeah, so the ones like that are labeled. So for instance, like the syphilis one here, the percentage is syphilis cases were identified as males. So that was in city of Milwaukee. I think that's what you're trying to refer to, like if it's county or city.
yeah, I was just trying to identify what the denominator was in a lot of the different percentages. So even if you go back a couple of slides, one more, I think. Oh, I don't remember where they were now, but they were just, I was unclear about what the denominator was, if it was like the whole population or of that group or so, but I can't remember the slide, so that's okay.
I'm sorry.
That's okay.
Yeah, what I would recommend is we do have our CHA actually posted on our website. And it's everything's labeled. So if it's sex or if it's the ethnicity, city, county level, like we are very descriptive when we talk about percentages.
Okay, I think we will move on then to the next portion where I'm going to share a little bit more about the priority issues survey. As Langston mentioned earlier, this was a survey we conducted this summer. And so we were at a series of events, our whole team, and we were distributing a survey that asked folks to identify their top 5 health priorities from a list of 36 different topics. And then on the back, we had questions about demographics, just so we could get a sense of who was participating in this survey. And so here on the slide, you'll see a list of the summer outreach events that we attended. And we had this survey translated into Spanish and Hmong, and was distributed at a couple of mosques that serve Somali and Burmese communities as well. And we were at a variety of health fairs, farmers markets, and neighborhood pop-ups all summer long. So without further ado, share the results. So the top 5 health priorities indicated by the folks who participated in our survey were: number 1, healthy foods and nutrition, and 42% of people indicated that this was one of their top health priorities. Number 2 was crime and neighborhood safety, and this was about 37% of folks. Number 3 was mental health. This was 27% of respondents indicated that mental health was a top priority. Number 4 was drug use, and number 5 was healthcare services. So I'm going to share a little that broken down a little bit more. And so of some of the topic areas that align with the topics that Ferris just shared data on, the top most common response was in the area of safety and violence prevention. So this was things like crime and neighborhood safety, reckless driving and motor vehicle crashes, interpersonal or intimate partner violence, or accidental injuries. And the second most popular was built environment, with the tie for third between healthcare access and economic security. And then fourth was the area of mental health, which also includes mental health outcomes itself, but also trauma and trauma-informed care, as well as social connection and social isolation. And then fifth was substance use. So now I'm just going to share a little bit information about who participated in the survey. So most of the survey participants were residents of the city of Milwaukee at 87%. A majority of the participants were Black, and the racial distribution resembles the city's racial diversity, with Black or African-American participants a little bit slightly overrepresented, which is great because that shows an opportunity to increase equity in the survey and get representation of different communities. So for those participants who identified as Black, the top 5 priorities were healthy foods and nutrition, crime and neighborhood safety, drug use, mental health, and then coming in 5th was reckless driving is one of their top 5. For folks who identified as white, the top priorities were, again, crime and neighborhood safety, with number 2 being healthy foods and nutrition. The third most popular was mental health, and the 4th was racism and other forms of discrimination, followed by economic security. For folks who identified as Asian, the healthy foods and healthcare services and mental health were all in the top 5 as well. And then, but also included was health insurance, the environment, so things like healthy and clean air, food, water, and climate change, as well as economic security. And then for folks who identified as American Indian or Alaskan Native, the top priorities were, again, healthy foods and nutrition, crime and neighborhood safety, drug use, mental health, and then also they identified accessibility and resources for youth and adults with disabilities as one of the top health concerns. Just over 19% of the participants identified as Hispanic or Latino. And for folks who identified as Hispanic or Latino, the top priorities by topic were healthy foods and nutrition, crime and neighborhood safety, healthcare services, and then they also indicated that education and dental health were important topics for them. Here you can see a map of the total participants by zip code. And so the ones that are darker are the areas where we had the most number of participants. These do kind of align with where we had the most number of events, but is also just to show that we have representation across almost all of the zip codes in the city. And this next map shows what are the most important health issues in each of those zip codes. So this dark pink color that is the majority of the zip codes represent that the #1 health topic in these communities was healthy foods and nutrition. As well as the lighter blue that you see a couple of the other zip codes across the city indicates crime and neighborhood safety was the top health topic in these areas. And then some zip codes identified at different priorities, like 53204 indicated that mental health was their #1 priority, and 53209 named education. And then these lighter blues are in 53213, that's lead, and then in 53220 was drug use. And these slides are available in that link that was shared earlier in the chat, so you can take a closer look at this map and let us know if you have any questions. Most of the folks who participated in the survey were between the ages of 35 and 44, but our youngest participant was 8, and the oldest participant was 85. And in terms of gender and sexual orientation, the majority of folks who participated, almost 75%, identified as female, but about 23% identified as male, and 1% of folks identified as non-binary or some other gender identity. And you'll see here too on the right, indicating that folks from a range of sexual orientations participated. So about 74% of folks were heterosexual or straight, and then 26% of folks represented other sexual orientations such as gay and lesbian, bisexual, asexual, pansexual, queer, or other. And then about an even number of folks that participated indicated that they rented their home as they owned their home. And so each of these made up about 45% of folks. And then another 10% had some other living situation. And the majority of that was folks who indicated that they were staying with family or friends. And then 1% of folks were either other or homeless or living in a shelter. And then we had also folks from a range of educational backgrounds, the most common response being folks who had a high school diploma or GED, and folks from a variety of income levels, and the most common being folks who indicated that they made less than $25,000 a year. And now I'm going to invite my colleague Amanda Daly to share the results of our photo voice contest that we conducted.
Thank you. Hello, everyone. My name is Amanda Daly, and we're just going to go over the photo voice results. So we asked the Milwaukee residents to go around the city and take photographs of what they thought made the city healthy or unhealthy. And then we asked you all to submit it with captions. And by the end of the contest, we received 86 photos across 16 different zip codes. And of those 86 photos, 71% were physical environment, 36% were social and economic factors, 36% were health behaviors, and then 4.7% were healthcare and public health. You might notice that these don't add up to 100%, and that is because each photo more than likely was stratified into 2 or more categories because that's just how they fit. And 2/3 of the photos we got fell into the physical environment category. And those were showing, I'm sorry, I jumped the gun. So 61 photos were received that fell into the physical environment category. Of those, 44 were positive, 17 were negative or could be perceived as negative. And over on the left, we have a photo that might be considered positive, and the caption for this is, it says, "This is a photo of a bumblebee pollinating one of Wisconsin's native flowers, the coneflower." And this shows the environmental health in Milwaukee, expressing how integrated nature is into the city. And that was submitted by Nora N. And over on the right, we can see one of the more negative photos. It's litter on the ground. And the caption for this one is, "A mask is healthy, but we make it unhealthy by throwing it on the ground." So 2/3 of the photos received were fell under the social and economic factors category. And the majority of these photos showed togetherness and socializing and just generally being together, while the remaining were broken homes and resource gatherings, such as food drives and clothing drives. And here we can see two of those 2/3 photos of the togetherness. On the left, we can see outdoor festivals promote camaraderie, community, and local business, and supporting local business, submitted by Jacqueline R. And then on the right, we can see, "We need to make sure we play in each other's yards. Remember when you were a child, how much fun that was. Tag your it, time for you to send in some photos, make it like a game, call it Beauty and the Beast." And that was submitted by Crystal W. And of the photos submitted that fell under health behaviors, a vast majority of those were positive, as can be seen on the left. Meditation and wellness, submitted by Shayla C., while only 3 of the submitted were considered negative. And I do want to note that all 3 of those were some kind of substance abuse, as pictured here. And the caption for this photo is, "The environment must come before substances and immediate gratification," and that was submitted by John C. So only 4 photos were submitted that fell under healthcare and public health. And that may just be because it's difficult to capture something like healthcare and public health via photos. But as you can see here, all 4 of the photos referenced COVID in some way. So on the left, we can see a lady wearing a mask. And the caption for this one is, "Masking you in public, keeping everyone safe," submitted by Christina S. And then on the right, "Healthcare heroes through COVID and beyond, our healthcare workers make Milwaukeeans healthier every day." And that was submitted by Julia T. So overall, we received 6 photos from 53211, and then 4 photos from 53208, 207, 206, and 215. And over on the map, you can see those indicated by the darker areas. And then I also want to note that if you don't see your zip code here, that's because there were no photos submitted for that zip code. And let's see. 100% of the submissions did come from Milwaukee residents, so that's great. And I believe that's all I got. Thank you.
Thanks, Amanda. So I'll wrap up sharing of our data sources from here. We'll talk about our forces of change work, as well as some of the county's findings as well. So the Forces of Change assessment was facilitated by our MKE Elevate Core Planning team and our Health Strategy team over the summer. So the assessment identified a variety of factors and their associated opportunities and threats that affect local public health systems. To conduct the Forces of Change assessment, we asked ourselves and the team 4 questions. What has occurred? What may occur? Are there any trends that have existed? What forces are occurring locally? And so 7 primary themes emerged, and they include what we see on the screen here. So racism as a public health crisis, infectious disease, economic security, labor shortages and inflation, local government and leadership changes, violence, and reproductive healthcare access. And so the 4 items in red also emerge as top issues across all data sources that we reviewed. Next slide. At the county level, so Milwaukee County's top health issue identified in the community health needs assessments are informed by 3 data sources: a community health survey, community stakeholder interviews, and secondary data of publicly reported health indicators. These top health issues are all interrelated and disproportionately affect communities of color. You can learn more about the data behind these issues and other findings in the 2021 Milwaukee County Community Health Needs Assessment at healthcompassmilwaukee.org. They highlighted some issues of concern, those top health issues, in addition to the top 5 health issues in 2021. They also ranked very high areas of concern, those issues of concern of maternal, fetal, and infant health, infectious disease, and chronic disease as well. All right. So our county health rankings compare county level data to state and national data. Milwaukee County falls in the lower quadrant displayed here as all counties are in navy. For both, they fall in the lower quadrant for both health outcomes and health factors, including adult smoking, physical activity and nutrition, sexually transmitted infections, healthcare access, children in poverty and income inequality, crime and injuries, air pollution, and housing. The three areas in red were also identified as top issues or community priorities in our other data sources and surveys. The county health rankings also show areas of community strength. In Milwaukee County, 3 areas stand out as better than the rest of the state by average, including access to exercise opportunities, fewer alcohol impaired driving deaths, and a greater availability of dentists. From our photo contest, we received a wide variety of examples of access to exercise opportunities, including trails, parks, bubbler bikes, exercise studios, and outdoor fitness classes. We also received photo submissions depicting healthcare centers and clinical care as well. All right, with that, we will open up the next Zoom poll. So this one is, what are 3 community health issues based on the data? What are your top 3 community health issues based on the data presented today? All right, and I accidentally mute or minimize mine, so I can't see it anymore. So if one of my colleagues can tell me what the poll says.
Yeah, we're at about 65% of folks participating, so we'll give it another minute or 2.
Thank you.
All right, 15 more seconds. Right, so it looks like by the results, in the lead, we have safety and violence prevention, followed closely by racism and health equity, and then mental health. And then a majority of folks indicated that that they would prefer that racism and health equity be its own priority work group and integrated into all of the other priorities. So thanks everyone for participating.
All right, so now what we're going to do is move into our small group discussions. In a moment, we will move into our breakout rooms. What we're going to do in there is first share some of our overall reactions and reflections about what we've learned today, leading with 2 questions here. What is something new that you learned or something that surprised you? Was anything missed that you feel should have been a priority? And then secondly, we'll talk about each health topic. We'll have a list of the health topics and give you all an opportunity to share some of your thoughts, feedback, concerns related with those topics. How do you think it's an issue? How do you think we can address it as a collective? Then we have a exercise, which is called a mock $100 exercise, and we'll describe that in the chat or in the breakouts in a little more detail. And then when you're in your small groups, if you can designate a spokesperson to report back to the large group, that would help facilitate that large group discussion and debrief.